Welcome and good afternoon to commissioners, commission staff, the witnesses, and the public watching and listening. This briefing will come to order. This is a briefing of the United States Commission on Civil Rights on the civil rights and protections in the federal response to Hurricanes Maria and Harvey. It is 12 p.m. on June the 25th, 2021. Commissioners virtually present at this briefing, in addition to me, are Commissioner Gilchrist, Commissioner Harriet, Commissioner Kursanow, Commissioner Cladney, and Commissioner Yaki. I am sad to say that Commissioner Degbele has a family and is unable to join us, and we'll hear more as we extend our condolences to his family for his loss. I note for the record that the staff director and the court reporter are present. Is that correct? Okay. I look forward to our briefing today. Yes, thank you. And our court reporter, is the court reporter ready?
I'm having a sound challenge.
The call coming through the National Press Club line now.
Okay, sound is ready. Yes, the court reporter is ready to respond now.
Thank you. Thank you.
Then they're on.
Great. Thank you. Yeah. I look forward to our briefing today and note that the commission business meeting scheduled for this afternoon following this briefing has been canceled. So we do not have a further meeting for the commissioners to attend. My name is Norma Cantu, and I am chair, and I wish to welcome everyone to this briefing on the civil rights in the federal response to Hurricanes Maria and Harvey. The commission undertook this project knowing full well that the Congress was already reviewing the federal responses to natural disasters. However, we'll be looking at the response through a civil rights lens. The commission will review Federal Emergency Management Agency, FEMA, and its role in disaster preparedness and response. We'll be looking to evaluate efforts by FEMA to comply with the Robert T. Stafford Disaster Relief and Emergency Act, along with other federal civil rights laws and policies. And our commission will compare the significant hurricane systems to Hurricanes Harvey and Maria. Commissioners will hear from subject matter experts such as government officials, academics, advocates, and impacted persons. Just to begin with a few housekeeping items, I share deep thanks to the commission staff who researched and brought today's briefing into being, including the team who have worked on logistics for which this virtual environment presents a whole host of additional challenges. And I thank Staff Director Morales for his leadership. I caution all speakers, including our commissioners, to refrain from speaking over each other for the ease of the transcription by the court reporter. Additionally, I will need to cue our staff behind the scenes for the appropriate video and audio support. So if occasionally you'll hear a phone ringing, that's probably for me and not for you. So please wait to speak until I've called upon you. During the briefing, each panelist will have 7 minutes to speak, and you'll see at the top of your gallery screen, you'll see the 7 down. The panelists, after they speak, then the commissioners will have an opportunity to ask questions within the allotted period of time. Now, that depends upon how long the folk take to present. It depends upon how many people ask. I would urge folk to get your most important question out first, because I'm doing some math here, and 11 panelists times 7 minutes each, that's already an hour and a half there. So we're going to finish on time. So I will strictly enforce the time allotments given to each panelist to present his and her statement. And unless we didn't receive your testimony until today, you can assume that we have read your statements. So you don't need to use some of your precious time to read that to us as part of your opening remarks. And please focus your remarks on the topic of today's briefing. For my fellow commissioners, I know they're cognizant of the interest of each one of us to ask questions. So please be brief in asking your questions so we can move quickly and efficiently through today's schedule. I will step in to move it along if necessary. And panelists, please note that I ensure that we'll have enough time. The 7-minute thing, in addition to the clock, you'll see me waving and trying to get your attention. That means that you're getting close to your last minute. And now I'm going to call on two of our commissioners, Commissioner Cladney and Commissioner Yaki. I've promised them a whole 2 minutes each for their opening statements, and I know they're going to do their best. If I can please call first on Commissioner Cladney.
Thank you very much, Madam Chair. Good morning. Commissioner Degbele, a co-sponsor of this project, will be unable to attend the briefing today because of an unavoidable family issue. As a co-sponsor of this project with Commissioner Yaki, Commissioner Degbele would like to thank our fellow commissioners, their special assistants and legal interns for this work on this project. A lot goes into these briefings. Also, the newly appointed leader of our Office of Civil Rights Evaluation, Merrick Xavier Breyer, was a great help on this. And by the way, congratulations, Merrick. We look forward to your leadership. Commissioner Degbele also wishes to thank Julie Greco of OCRE for her hard work in researching and preparing this issue for this briefing. Of course, he thanks his special assistant, Irena Vidulovic, and legal intern Alana Thomas, communications director Ainge Rorison. Finally, we would not be holding this briefing if it wasn't for the great coordination and logistics work of Ms. Pam Dunstan and her staff. She is there all the time when this commission asks her to make briefings happen in our office, in the field, or online. Thank you, Ms. Dunstan, and thank you, your entire staff, the entire staff of the commission. On a personal note, I would like to thank my very special assistant, Amy Royce, who has always prepared for this briefing in excellent fashion, and our new legal intern, Clara Malkin, who is following in Amy's footsteps. Great job. These hurricanes dealt a serious blow to millions of Americans, which many are still suffering the consequences today. The questions need to be asked if the government response was sufficient enough for the United States to be proud of its civil rights record, or if there were civil rights failures that resulted in more harm than what the hurricanes levied on our citizens. Commissioner Degbele thanks the witnesses and participants for attending and participating in today's briefing. Thank you, Madam Chair.
Are you waiting to may I go? I'm Commissioner Michael Yaki, and in 2017, as I was watching the response for Hurricane Harvey, I couldn't help but be reminded of the response to Hurricane Katrina over 10 years before, and the images that we saw of the people who were stranded, of the Ninth Ward being devastated. And on a personal note, I am someone who, like many millions of Americans, survived a natural disaster. I rode through the Loma Prieta earthquake of 1989 in the San Francisco Bay Area. And I was fortunate in many ways. I was fortunate because my home was not damaged, but I was also fortunate because I had a couple of advantages other people did not. I had a law degree, I had a copy of the Stafford Act, and I worked for a member of Congress. And in that role, we worked to help the thousands upon thousands of people who were needing assistance after the quake. And it gave me a newfound appreciation and understanding, and quite frankly, a very skeptical eye of our nation's federal response efforts in the wake of a disaster. And to that end, I began advising other offices throughout the time I worked in Congress about how to respond to disasters and how to work with FEMA. And it's quite frankly a little shocking to see that many years later, not too many things have changed. And in fact, in our mission as members of the Commission on Civil Rights, to note that there may be a disproportionate impact of the federal response with regard to its treatment of people of color to disabled is something that I find shocking today. And I hope that the panelists today will focus on that. I don't need to see 5 paragraphs of statistics about how we're investigating fraud and abuse. I want to know what the Southeast Texas Regional Planning Commission was doing with CDBG-DR funds with regard to how it was being allocated, and whether it's being allocated in a way that favored one population over another on the basis of color. I want to know why the amount of aid that gets distributed disproportionately favors one group over another. And I would just note that for the record that on the information that we were provided already, it appears that people in Hurricane Harvey received $1,600 more per person than anyone in Hurricane Maria in Puerto Rico. These are the hard questions we need to ask, and we need answers. And I'm thankful for everyone who's helped put this together. I look forward to your testimony, and let's proceed.
Thank you, Commissioner Yaki. Let me now introduce the 7 people on the first panel. Our first speaker this morning is David Bebo, Acting Associate Administrator, Response and Recovery, FEMA. Our second speaker is Tony Robinson, Region 6 Administrator, FEMA. Our third speaker, Glenn Sparr, Principal Deputy Inspector General, Department of Homeland Security, Office of the Inspector General. Our fourth speaker is Stephen Begg, Deputy General, Housing and Urban Development, Office of the Inspector General. Our fifth speaker is Chris Curry, Director, Homeland Security and Justice, U.S. Government Accountability Office. Our sixth speaker is Tevi Troy, author, BPC Senior Fellow, and former Health and Human Services Deputy Secretary. Our seventh and final speaker on panel 1 is Linda Johnson, Director, Office of Equal Rights, FEMA. And please note the countdown clock at the top. You may begin, Mr. Bebo. Please proceed.
Madam Chair, thank you for the opportunity to join the U.S. Commission on Civil Rights proceedings today. I very much appreciate the chance to talk about our work with Hurricane Harvey and Maria, as well as our work going forward. I first joined FEMA in 2009 and have served as a member of the Senior Executive Service here at FEMA since 2012. During the 2017 hurricane season, I was the acting head of policy for FEMA. In that position, I helped lead the agency through a number of policy challenges related to the response and recovery efforts and the delivery of federal disaster assistance following the devastations that Hurricane Harvey and Hurricane Maria brought to Texas and Puerto Rico, respectively. At the time, I was also involved in FEMA's efforts to enhance disaster assistance for Puerto Rico and the U.S. Virgin Islands, including with language that was included in the 2018 Bipartisan Budget Act. This language that Congress passed, the President signed, has and continues to give us greater flexibility in providing funding toward restoring Puerto Rico's infrastructure and that of the U.S. Virgin Islands. Specifically, allows us to restore certain disaster damaged facilities and infrastructure without regard to the pre-disaster condition of that infrastructure, which is something that we normally are not able to do under our authorities in the Stafford Act. Further, it also allows us to restore the function of facilities and infrastructure to industry standards without regard to whether the entire system of infrastructure was actually damaged by the disaster. Another important factor in helping to enhance and bolster Puerto Rico and U.S. Virgin Islands recovery from Hurricanes Irma and Maria. Since January of 2020, I have served as FEMA's acting associate administrator for response and recovery. In this role, I'm responsible for leading our response, recovery, logistics, and field operations functions nationwide in support of our 10 regional administrators who are distributed across the country. The historic 27 hurricane season and wildfire activity, I'm sure you will recall, certainly demonstrated how vital the local, state, tribal, territorial, and federal partnership is in delivering disaster assistance to the American people. Harvey, Irma, and Maria were 3 major landfalling hurricanes that affected the continental and outside of the continental United States in relatively quick succession, affecting 15% of the United States population, or roughly 47 million people. And as we know, the effects of Hurricane Maria on Puerto Rico's infrastructure were significant, and we continue several years on to work with the government of Puerto Rico, as we do in Texas and elsewhere, to facilitate the recovery. And I think important to recall that following Maria in Puerto Rico, every airport and port were closed. Only 5% of the population had access to cell phone service, and 3.7 million residents were without electricity. The challenges that a community faces in advance of a disaster, before a disaster, whether it's poverty, housing constraints, fragility of infrastructure, are unfortunately all exacerbated by disaster. And that makes the response effort and the recovery effort all the more challenging. FEMA, along with our partners across the federal government in support of the states and the territories, continue to provide historic levels of support to not only the government of Puerto Rico, U.S. Virgin Islands from Maria and Irma, but also to Texas and Florida from Harvey and Irma. In the Puerto Rico case, this includes the award of the 3 largest recovery grants in FEMA's history to rebuild large portions of Puerto Rico's infrastructure, particularly the power grid, the water system, and school facilities. Here on the mainland, as you all know, Hurricane Harvey posed historic challenges for the Houston area in the aftermath of the storm. More than 42,000 people required sheltering assistance, which was a substantial mission that I'm sure Tony will talk more about. We've come a long way in the recovery operations from Harvey and Maria. The recoveries continue today. We know that we have more to do, and FEMA remains committed even as we prepare for what may come next. I think it's important to know that the Biden administration priorities inform very much the FEMA administrator's priorities, particularly around promoting equity and addressing the effects of climate change. Climate change is making disasters more frequent, more intense, and we're seeing greater destruction. And we know we must all work together to address these challenges head on through risk reduction projects to build more resilient communities. And then we must consider equity and socially vulnerable populations in all that we do. At FEMA, we are continuously reviewing our program delivery, our decision-making, and our responses to improve our support that we provide to disaster survivors. We look forward to working and continuing to work with our partners who are also represented here on the panel today. And we look forward to the feedback and the questions from the commissioners to help drive forward the FEMA administrator and the broader administration's commitment to promoting equity in everything that we do. I look forward to the questions from the panel, Madam Chair. Thank you.
Thank you, Mr. Bebo. Now we will hear from Mr. Robinson. Please proceed.
Good afternoon, Chair Cantu and distinguished members of the Commission. My name is Tony Robinson. I'm the Regional Administrator of FEMA Federal Emergency Management's Region 6 office in Denton, Texas, which is responsible for the states of Arkansas, Louisiana, New Mexico, Oklahoma, Texas, and the 68 travel nations that are within that geographic area. I've been with FEMA since 1987 and served as a Regional Administrator in Region 6 since 2013. Our regional office is located in Denton, Texas, and we have geographic-based offices in Baton Rouge, New Orleans, Austin, and Houston, with FEMA integration team members co-located in state offices in Arkansas, Oklahoma, and New Mexico, with the purpose to build partnerships and capabilities with the emergency management community. We also have tribal liaisons located in New Mexico and Oklahoma, where 61 of our tribal partners are located, with the intent to closely collaborate with our tribal nations and to place our workforce closer to the communities that they serve. I'm particularly proud of the regional workforce, and that includes people who have chosen to work at FEMA after personally being impacted by disasters themselves. Region 6 has seen some of our nation's largest disasters, and our team has responded to many notable disasters, including a very busy 2020 hurricane season, which included 5 storms impacting Louisiana and Southwest Louisiana being significantly impacted by Hurricanes Laura and Delta, which made landfall within 12 miles of each other. Our disaster work is in addition to our constantly evolving steady state mission that requires our team to tackle new challenges on a regular basis, including most recently the extensive COVID-19 work that was related to supply chain issues, personnel support, and vaccine distribution. In 2020, the region awarded $18 billion in grant funding to assist our partners in building capabilities and for disaster recovery. That gives you some background on FEMA Region 6. Now I'll give you just some specifics on Hurricane Harvey. Hurricane Harvey made landfall near Rockport, Texas as a Category 4 storm with its peak intensity on August 25th, with the storm remaining inland for several days, finally departing the state on August 30th. In addition to wind and storm surge along the Texas coast, heavy rainfall and widespread flash flooding directly impacted 6.7 million people across an area approximately 41,500 square miles, including our nation's fourth largest city, the city of Houston, as well as many small and medium-sized communities along the coast and deep into the interior of Texas. During the storm, the highest rainfall total amount that was reported was just a little over 62 inches in a rain gauge outside of Houston. In total, 41 counties were designated for FEMA's individual assistance program and 53 counties for our public assistance program. We also had 91,000 flood insurance claims that were filed during this period, with $8.8 billion being paid out for those claims. A cornerstone of our response to recovery approach is to place our staff and services in the areas with the greatest need. To reach these communities, we took the following actions. We opened more than 100 disaster recovery centers across the impacted area, using both fixed and mobile sites. These DRCs saw more than 200,000 visitors. We deployed dozens of disaster survivor assistance teams who canvassed shelters, visited hard-hit neighborhoods, and contacted more than 500,000 survivors. And additionally, our staff participated in more than 400 community events to assist and engage survivors throughout the recovery. We understand that communities cannot fully recover from a disaster if their population does not return, so we do our utmost to keep survivors close to as home as possible while they recover. And this was true in our immediate harbor recovery efforts as well. The volume of applications for this disaster was one of the highest in FEMA's history. In total, we provided more than $1.6 billion in grant funding to more than 373,000 individuals and households through the individual and household program. Additionally, $121 million in financial assistance to applicants were provided for immediate and critical needs because they were displaced from their primary dwelling. Housing assistance after disasters can be extremely challenging, and in a disaster of the magnitude of Hurricane Harvey, these challenges were multiplied. We work very closely with our states and the lessons learned from the 2016 floods in Louisiana to partner with the state of Texas to deliver some new and innovative programs. So in addition to some of our traditional programs like congregate, non-congregate sheltering, sheltering assistance, home repairs, lodging expense repairs, there were two innovative programs, which were the Shelter and Temporary Emergency Power Program, which Texas called PREPS, for portable or partial repair and essential power for sheltering, and then permanent housing construction, which was a new program that was direct housing assistance limited to home repair. In addition, we used geographically dispersed model for case management, assigning specific impacted counties between the Texas Health and Human Services Commission and the national voluntary organizations active in disasters, and this helped us better serve our disaster survivors. The size and scope of Hurricane Harvey's impact would have been challenging in a normal year, but the subsequent disasters, as Mr. Bebo mentioned, really placed a considerable strain on our FEMA resources. I'm extremely proud of the FEMA staff and our partners with Texas Division of Emergency Management, along with our local, state, tribal, non-governmental organizations, and our private sector resources. Disasters are a whole community business, and that certainly worked in the state of Texas. There are always lessons that we can learn from disasters. From our previous work, we implemented some of those things we learned in Louisiana, and we're committed to improving in meaningful ways every day. Our work recovering from Hurricane Harvey is not yet complete, but we've already begun to establish a great deal in supporting our partners along the long-term recovery efforts. To date, we've obligated over $2.4 billion for public assistance and more than 19,000 projects. There are only 509 projects that remain open in Hurricane Harvey. In total, FEMA Stafford Act program provided over $4 billion of assistance. That's from our individual assistance, public assistance, and hazard mitigation program, and we temporarily house over 19,000 survivors in this disaster. We remain committed to working with our federal, state, and local partners to make our nation more resilient and to learn from the challenges we faced during Hurricanes Harvey and Maria and subsequent disasters, including the COVID-19 pandemic, to ensure that all citizens have equal access to our programs in compliance with our nation's civil rights laws and policies. Thank you for the opportunity to be part of this public briefing, and I look forward to answering your questions. Thank you.
Thank you, Mr. Robinson. We'll now hear from Mr. Sparr.
Good afternoon, Madam Commissioner and Commissioners. I'm Glenn Sparr, the Principal Deputy Inspector General at Homeland Security. Thank you for the opportunity to discuss our oversight work today, specifically our oversight of FEMA's disaster response and recovery efforts in Hurricanes Harvey and Maria. Our office plays a unique but critical role in the oversight of disaster management. We ensure disaster programs are operating in an effective and efficient manner, and that public funds are spent in accordance with regulations. We are well aware of the hardships that multiple hurricanes stacked in a tight window in late 2017 placed on FEMA. And we acknowledge the efforts of dedicated FEMA employees and contractors who persevered through these difficult circumstances. Work that was often accomplished far away from home. That said, we found many opportunities for improved performance in the future. Effective intervention from FEMA can mean the difference between life and death for some disaster survivors. With those stakes on the line, we do not shy away from issuing tough recommendations for improvement. Our oversight team was on the ground less than 2 months after Hurricane Maria hit Puerto Rico. Our team spoke with multiple individuals who noted serious problems with the distribution of meals and water, such as containers arriving that were supposed to be filled with food and water, but were either half empty or carrying unrelated goods. FEMA lost visibility of about 38% of its commodity shipments to Puerto Rico, worth an estimated $257 million. Overall, we conducted 10 audits related to our oversight obligations, and we published corresponding reports between May 2019 and June 2021. Audit topics included acquisition, contracting, and controls, distribution of commodities, oversight of grants, management of disaster assistance funds, and oversight of the IT environment. Specifically, we noted shortcomings in FEMA's acquisition and contracting controls. For example, FEMA inappropriately awarded 2 contracts to supply roof tarps and plastic sheeting to disaster survivors in Puerto Rico. Within a month, FEMA had canceled both contracts because the contractor did not deliver those tarps and sheeting. In addition, FEMA's public assistance grants to the Puerto Rico Electric Power Authority, PREPA, and PREPA's subsequent contracts with 2 contractors to fix the electrical grid did not fully comply with federal laws and regulations, as well as program assistance guidelines. This led to potentially ineligible contract costs and FEMA reimbursing PREPA more than $852 million for contract costs without confirming PREPA provided proper oversight of the contract. Another electrical grid contract that we reviewed was billing at a rate of $616 per hour for a senior accountant. Additionally, deficiencies in FEMA's management of commodity distribution in Puerto Rico led to lost visibility of commodities and delayed shipments. For example, water deliveries had an average shipping delay of 71 days. In food items, average shipping delays of 59 days. Of the approximately 97 million liters of water FEMA shipped to Puerto Rico between September 2017 and April 2018, only 36 million liters reached their final destination for distribution. During the same period, only 24 million of 53 million shipped meals reached their final destination for distribution. Further, FEMA's oversight of its IT environment to support response and recovery efforts was inadequate. FEMA's legacy IT systems were not integrated and did not have the functionality needed to keep pace with high volume processing. Looking forward, THSOHE has 6 ongoing audits and reviews related to both disaster and pandemic oversight that we initiated based on our observations during visits to these disaster sites and our post-disaster analysis. We look forward to publishing those reports. Our criminal investigators also investigated fraud and abuse related to these disasters. Since April 2017, we've initiated 249 investigations related to Hurricanes Harvey and Maria. We have activated or leveraged resources aimed at combating criminality and procurement, grant fraud, disaster application benefit fraud, identity theft, impersonation of FEMA or law enforcement officials, and DHS employee misconduct. For example, we investigated the $1.8 billion electrical power contract in Puerto Rico, and this resulted in the indictments of a former FEMA senior executive, a second former FEMA employee, and the former president of an electrical company. In conclusion, FEMA faced tremendous challenges meeting mission requirements because of the catastrophic nature of Hurricanes Maria and Harvey and multiple concurrent nationwide disasters. We hope that our testimony today has provided the commissioners with a holistic view of our oversight work of FEMA's responses to these disasters. I welcome any questions. Thank you.
Thank you, Mr. Sparr. Mr. Begg, we will now hear from you.
Thank you, Madam Commissioner. Distinguished commissioners and commission staff, thank you for the opportunity to participate in this briefing. As the Deputy Inspector General for the U.S. Department of Housing and Urban Development, it is my pleasure to discuss our office's work related to HUD's disaster recovery programs and Hurricanes Harvey and Maria. HUD's disaster programs are designed to assist individuals and communities in long-term recovery from disasters and in mitigating the potential effects of future disasters. In recent years, disasters and federal spending on them have increased exponentially, and we expect them to continue increasing. Since 1992, Congress has appropriated over $89 billion of grant funds through HUD's disaster programs. A substantial portion of that amount, approximately $30 billion, has been appropriated to assist Texas and Puerto Rico in the aftermath of Hurricanes Harvey, Irma, and Maria. The Office of Inspector General provides independent, comprehensive oversight of HUD's disaster programs through audits, evaluations, reviews, and investigations. For several years, we have identified the administration of disaster recovery assistance as a top management challenge for HUD. We focus a significant portion of our oversight portfolio on promoting effectiveness, economy, and efficiency in HUD's disaster programs, as well as preventing fraud, waste, and abuse in them. Our office appreciates this opportunity to highlight several interrelated themes from our work and to emphasize to the Commission our support for codification of HUD's disaster programs. We believe that creating permanent program requirements through codification will help disaster grant funds reach the individuals and communities in need more quickly, and that codification will generate more effective outcomes in HUD's disaster programs. Currently, HUD establishes its disaster program requirements through notices in the Federal Register rather than through its regulations. Each time Congress appropriates money for a disaster, HUD generates a Federal Register notice specific to that funding stream. This process can quickly become complicated for grantees, as they may need to examine multiple notices to understand the requirements related to a disaster. For example, in February 2017, Texas had 6 open grants and was required to follow 48 different Federal Register notices to administer them. We identified that many of the HUD requirements in these notices are the same across grants and disasters. In 2018, we recommended that HUD codify these requirements in regulation to provide consistency and clarity for grantees. Doing so would reduce delays in grantees' planning efforts and allow them to build programs that could be executed efficiently in future disasters. In April 2021, we again recommended that HUD codify its disaster programs after we found that HUD's extensive negotiations with the Office of Management and Budget about new program requirements significantly delayed the release of Federal Register notices for Puerto Rico, Texas, and other grantees receiving disaster mitigation funding. Establishing a permanent set of requirements would reduce uncertainty early in the grant lifecycle and help grantees build capacity to administer grants more quickly. We have consistently identified that disaster grantees struggle with staffing, procurement, and implementing strong internal controls early in the process. We found these capacity issues existed for HUD grantees in Texas and Puerto Rico, and that the unprecedented amount of grant funds they were initially charged with administering was a significant factor in their struggle to establish capacity. We have also found that lack of clarity in program requirements generates delays and ineffectiveness later in the grant lifecycle. In our 2020 report on HUD's top management challenges, we highlighted our concern with the significant number of disaster recovery grantees that HUD has designated as slow spenders. We are currently conducting work to examine how HUD monitors these grantees and assist them in improving the timeliness of their activities. Our other recent reviews have highlighted that standard requirements would help grantees better deliver core recovery functions, like rebuilding and rehabilitating homes. In addition to the longstanding challenges in these programs, we recently surveyed HUD disaster grantees and found that the COVID-19 pandemic caused many aspects of their recovery activities and operations to slow down or stop entirely. Grantees struggled during the pandemic to communicate with their partners and advance construction projects due to health and safety restrictions in many jurisdictions. As grantees continue grappling with these challenges and our communities face increased threats from disasters, our office will continue using our oversight toolkit to help HUD achieve its strategic objective to support effectiveness and accountability in long-term disaster recovery. We believe that codification of HUD programs is an important first step in fulfilling that objective. Thank you for the opportunity to discuss our work with you today. I look forward to your questions and to continue providing information to the Commission that may further your important work.
Thank you. We will next hear from Chris Curry. Please proceed.
Okay, thank you very much. Appreciate the opportunity to be here today. I'd like to start by discussing just federal disaster assistance in the US and what the future is going to look like first. There are at least 29 federal agencies, including FEMA, that provide disaster aid to individual citizens and also to states, territories, Indian tribes, and other local governments. Just to give you a sense of the scale, since 2005, the federal government spent over $500 billion. That's over $500 billion on disaster assistance and aid. And while Harvey and Maria are certainly huge catastrophic events, they get a lot of attention. The US is experiencing more and more severe weather every day due to climate change. Thunderstorms are causing massive flooding in places that don't typically see this, places like West Virginia, Tennessee, Nebraska. Wildfires are changing from localized rural events in the past to state, region-wide events, and sometimes now urban catastrophes. From 2016 to 2018 alone, 5.6 million people applied to FEMA for assistance, and that doesn't even include other federal agencies. That's just FEMA. It's important to understand these statistics because the federal government is bearing more and more of the burden for these increasing disasters and costs. We found that most states, territories, localities, and tribes, they don't have a rainy day fund to pay for disasters. They rely on the federal government. And the picture's worse for our citizens. Many have no emergency funds to pay unexpected bills, let alone to prepare for disasters. Many are also very underinsured. This means that more and more people will rely on federal help after disasters. And before I talk about some of our findings, I do want to say that we get to observe the dedicated staff from FEMA and other agencies every day in our work. They work long and hard hours to serve our citizens and communities. They're also committed to improvement when we identify challenges and weaknesses as well. And on that note, our work has identified a number of challenges across federal disaster programs, all of which were used during Hurricane Harvey and Maria and every other major disaster. A key theme that has emerged is that individual citizens or states, localities, or territorial tribal governments with fewer resources, capacity, and experience, not surprisingly, face greater challenges navigating federal programs and assistance. Our work has also shown areas where changes could help vulnerable populations. For example, after the 2017 disasters, we found that elderly survivors and the disabled face challenges in registering for and obtaining assistance. For example, at the time, there was no way for survivors to indicate a disability need when they registered with FEMA. We recommended they do that. FEMA has since taken action to address that. The groups also faced challenges obtaining supplies because they couldn't reach centralized distribution centers. That was also a problem. We also found that some components of FEMA's individual assistance enrollment process may unintentionally make it difficult for vulnerable populations to obtain assistance. Multiple steps in this process can be confusing, can be highly technical, can be time-consuming to navigate, requiring the survivor to follow up with incomplete information. This lands harder on those with less education and jobs where they can't sit at a computer all day or be on the phone going back and forth with the federal government. We have recommended that FEMA look at these components in their process for opportunities to streamline it where possible, and that could encourage further participation and better outcomes for vulnerable populations. Another major theme is that state and local resources are a huge factor in the effectiveness of preparedness, response, and recovery efforts. And they also dictate the amount of federal help that's going to be needed along the way. For example, in Puerto Rico, the Virgin Islands, and we can't forget the Pacific territories that were hit really hard in 2018, serious fiscal constraints, years of depleted tax bases, and large populations in poverty led to lack of planning and preparedness for major disasters over the year. The result was that FEMA and other agencies had to step in to more directly help, not surprisingly. This also severely affects the long-term recovery and the long-term outcomes, which is extremely important for understanding how communities and people get back on their feet in the future. We've reported that Puerto Rico's fiscal constraints have made it very difficult to fund and start large infrastructure repairs after Maria, even under, when there's been a lot of federal help. This is in stark contrast to other states like Texas, Florida, California, that can provide the upfront funding to jumpstart recovery because they're able to secure debt or move other funds in their budgets to start paying for these projects, whereas Puerto Rico and others are solely reliant on federal funds, which some cases don't actually come till years after the disaster. For example, in January 21, Puerto Rico had spent, we just reported this, they had spent $158 million to start, long-term rebuilding projects like schools, the power grid, and water systems. This is out of $23.8 billion at that time that FEMA had obligated. So it shows you that while the funds are obligated, meaning they're ready to start, the upfront funding is not there to start some of these projects because they're reimbursed later. Tribal governments face similar challenges. We surveyed tribes. They struggle to build and maintain emergency management resources. This also makes it difficult for them to navigate complicated disaster programs across numerous agencies like FEMA, HUD, SBA, and many others. In closing really quick, GAO has a lot of work going on right now on how the federal government, not just in the disaster area, but across the federal government, is assessing equity in their programs and how they're implementing the president's recent executive order on equity. One thing that is emerging is that collecting better data is really key to this process so you can start assessing these programs. This is a new lens that we're looking at these programs through in many cases. And so it's going to require a number of steps to get to the point where we can make good conclusions about what reforms might be needed. So thank you for the opportunity to be here, and I look forward to the discussion.
Thank you, Mr. Curry. We will now hear from Mr. Troy. Proceed.
Thank you. Thank you for inviting me to testimony. And thank you to Mr. Curry for a very interesting testimony. I learned a lot from that, and I appreciate it. I'm a former Deputy Secretary of Health and Human Services and White House aide. While I was in government, I was involved in the response to 3 disasters: 9/11, Katrina, and the 28 economic collapse. I also helped prepare for another, pandemics. My time in government, coupled with my background as a presidential historian, led me to write the book, Shall We Wake the President? 2 Centuries of Disaster Management from the Oval Office, which is a look at presidential responses to disaster and an examination of how to better handle them. I learned in writing the book that over the course of our history, the federal government has become increasingly involved in dealing with disasters. As this involvement has increased, so has the American people's expectations regarding federal disaster response. In addition, the scope of disasters covered by the government keeps increasing and has steadily done so over the last century. Whereas weather disasters were once local problems, they are now national issues, and the federal government is increasingly expected to prevent them from happening, rescue people while they are happening, and make people whole after they happen. Along with this increased scope of disasters covered is an increase in presidential involvement, which is my area of expertise. We can see this by looking at how presidents have dealt with 5 major weather-based disasters: 1889's Johnstown flood, 1927's Mississippi floods, 1969's Hurricane Camille, 1992's Hurricane Andrew, and 2005's Hurricane Katrina, all of which I elaborate on in my written testimony, and these illustrate the growth of federal involvement over our history. This background is crucial in looking at the federal response to 2017's Hurricanes Harvey and Maria, the subject of today's hearing. Let's look at Harvey first. Having lived through the government's ineffective response to Katrina, I was encouraged by what the federal government and particularly FEMA seemed to have learned in the intervening period. As a result of Harvey, or in response to Harvey, things seemed well coordinated. FEMA worked well with state and local officials, pre-deployed key resources and personnel in advance, and adopted new approaches. To identify how to get resources and rescuers where they need to go, FEMA now tracks Facebook and Twitter to identify people and places in need of assistance. In addition, FEMA operation centers are now high-tech multi-screen environments, giving emergency managers far more real-time information than we had in previous disasters. Another improvement we saw during Harvey was in the integration of volunteers. Government does not have enough personnel to help everyone who needs it. These limitations make outside assistance invaluable. Volunteer assistance is not just about the Red Cross anymore. FEMA's website lists about a dozen professional volunteer organizations to cooperate with during disasters. Given these improvements, the question arises of why the Harvey response was a success while the subsequent Maria response was seen as subpar. One obvious reason is the challenge of disaster response off the mainland. Getting resources to an island is just much harder without the interstate highway system. As a FEMA official told me at the time, to say it's logistically challenging is an understatement. This challenge was compounded by the devastation on the island. Maria's first responders in Puerto Rico were also her victims, and many were unavailable to the response effort. The result is that FEMA faced both its normal job of transporting supplies, but also the typically local responsibility of distributing them to the populace. In addition, it's harder for residents themselves to evacuate when planes and boats are the only avenues of escape. We often see lines of cars on Interstate 95 headed north from Florida before hurricanes. Such an escape route was not available to Puerto Ricans before Maria. This hurdle also made it that much harder for good Samaritans on the mainland to come to their assistance, which did in great numbers in Harvey. A second difference for the difference in responses stems from the challenge of coping with serial disasters, which is something that's been mentioned earlier. While post-Katrina reforms improved FEMA's surge capacity, its ability to handle more than one disaster at a time, FEMA, like any government agency, has limited resources. Its appropriations run out quickly, requiring a less than nimble Congress to provide disaster funding. And FEMA personnel who do heroic work are only human and subject to exhaustion when faced with constant deployments and redeployments over a short period. Third, Maria was so powerful that it devastated the island's power and communications infrastructure. This put FEMA at an immediate disadvantage in its response efforts. Finally, and this is outside the FEMA purview, is the issue of presidential focus. The White House seemed ready for Harvey, but less ready for a spate of continuing hurricanes over an entire month. The lesson here is that presidential leadership is about continued effort in the face of ongoing challenges. I would now like to make some suggestions for how to improve our hurricane response going forward. As much as we laud our technological progress for good reason, the fact remains that there is little that government officials can do in the short term, and even in the long term, to prevent or minimize the physical impact of catastrophic weather events. As a result, the president and federal government need to ensure that they do not overpromise and make sure that they meet the properly calibrated promises that they do issue. Even this is not easy. The federal government is a massive bureaucracy with 2 million employees, a number impossible to control. President Obama once recounted a warning he had received from Defense Secretary Robert Gates. Somewhere, somehow, somebody in the federal government is screwing up. Nothing can ensure the absence of mistakes, but smart leadership can better prepare officials for crises. Presidents should make sure that senior officials engage in preparation drills early in their administration and continue to do periodically throughout. The president also needs realistic budget numbers. The government spends a staggering amount of money on disasters, but does not budget properly for that spending. According to the Center for American Progress's Daniel Weiss and Jackie Weidman, the US government spent $136 billion on disaster relief between 2011 and 2013, about $400 per US household. This spending takes place among 29 departments. The US Department of Agriculture alone has 19 disaster-related programs. Another problem is the degree to which disaster funding is improvised. The federal government does have an annual disaster contingency fund of about $29 billion. It actually spent $136 billion, as I said, from 2011 to 2013. This improvisational approach harms attempts at responsible budgeting, but it also harms the affected communities, imposing additional burdens on communities in need. It is also inefficient. Each bureaucracy through which disaster money is directed spends money in the process of directing said funds. At the end of the process, less money ends up in the hands of the victims than taxpayers directed on their behalf. These suggestions should in no way take away from the tremendous job that our disaster response officials do. The career officials in the US government who deal with disaster are dedicated and skilled professionals. No one can prevent or eliminate the consequences of disasters, but we should appreciate their good work of these individuals and strive for improvements that will make their jobs easier going forward. Thanks again for inviting me to testify.
Thank you, Dr. Troy. At this point, we're now going to hear from Ms. Johnson. Please proceed.
Thank you so much. And thank you for having me. And good afternoon, everyone. Chair Cantu, commissioners, and commission staff. Thank you for your interest in the important work of the Federal Emergency Management Agency. It's my pleasure to join this briefing today, together with my colleagues, to address the commission's questions. Just a brief bit of background. I joined FEMA in July of 2018, well after the historic 2017 hurricane season. However, I joined FEMA in large part because of the 2017 hurricane season. In the summer of 2017, I was with another DHS component leading their civil rights function. That season overwhelmed the country, as noted by Mr. Sparr. And when FEMA sought volunteers from its sister agencies with DHS, I volunteered and was deployed to assist on the ground. I spent 6 weeks observing firsthand the powerful help FEMA provides to people and to communities. I also saw firsthand the limitations of FEMA programs. I was compelled to join as a result of this and join the effort to see how I might assist the 20,000 plus dedicated professionals who are working across FEMA. Mr. Bebo and Mr. Robinson described the scope and size of responding to disasters, as well as the significant efforts that were put in the wake of Harvey and Maria. Mr. Curry described the scope and size of responding to disasters generally, and I agree with Mr. Troy. I learned a tremendous amount from his opening statement. He also described the significant improvements that FEMA has made and continues to make with every new lesson learned. In our statement, we have provided the Commission detailed information on civil rights concerns raised from Harvey and Maria, as well as the subsequent outcomes. I welcome questions related to this information and appreciate the opportunity to hear your concerns, and I look forward to the discussion. Thank you.
Thank you, and the gift of time is greatly appreciated. I've got commissioners who really do have questions. I'm going to ask if you, commissioners, would you please just ask one or two of the panelists rather than ask all seven to respond to your questions. I'm going to allow Commissioner Yaki to go first and stick to the 2 rule because I would like to have possibly a second round.
Thank you very much,
Yaki.
Madam Chair. Thank you very much, Madam Chair. This is directed at Acting Associate Director Debo or possibly Ms. Johnson as well. As a general observation, and I think I foreshadowed this in my preparatory remarks, this is not an oversight hearing about how FEMA responded. to Harvey and Maria. This is an oversight. This is a oversight hearing about the civil rights implications of what that response was. And in some of the, in at least 2 different studies of the data from the actual response by FEMA to Harvey and to Maria. One study said that if you were in a neighborhood with a higher proportion of Black residents, the chances of you getting an inspection was diminished, and that when you finally did get an inspection, there was an 11% denial without explanation rate versus for white neighborhoods that had only 4%. And in addition, there was also a disparity in the amount of money awarded in the amount of 5 to 10% difference. Another study showed that blocks with significant numbers of non-white residents who had lower credit scores and lower income also had much lower approval rates and much lower, again, amounts of money given, which is kind of contrary to exactly what it is we're trying to do. I'd like to get your response to those 2 studies and what you believe of the data and what the agency has done as a result of this.
Commissioner, thank you for the question. And let me start by saying that for the first time in my service at FEMA, we have an administration and an administrator who has made promoting equitable delivery of disaster assistance one of the agency's top priorities. And I think it's just important to note that at the outset. So we are aware of a number of studies that associate FEMA assistance with inequitable outcomes for disaster survivors. The Commission, I'm sure, is aware of recent reports in newspapers, national level newspapers that have shined a spotlight on this and shined a spotlight on, again, on studies that would suggest that FEMA may provide less assistance to survivors of different demographics. So we take these studies seriously. We take seriously the findings, and we are digging into this as an agency. We have made it a priority to do so. We have launched an equity review of the individual assistance program, which is the precisely the program, Commissioner Yaki, that you're referring to in your remarks from a moment ago. And as I say that, I think it's also important to reaffirm that there are a number of specific factors that figure into the delivery of disaster assistance to individuals. Every circumstance is different, even though there are commonalities among them. Until you really dig in and look at a one-to-one comparison and understand the specifics, it is difficult to generalize. And one of the reasons it is difficult to generalize is because up to this point, and we are working very aggressively on this right now, we have not gathered demographic data for our individual assistance applicants. And so we have an obstruction in that regard because we need to have that data in order to do analysis ourselves and to be able to track equity in delivery of the assistance that we provide. That is one of a number of initiatives that we have underway to strengthen our ability to evaluate and then act on the equitable delivery of disaster assistance.
Are you saying that until now, despite Katrina, despite everything, there's been no systemic effort to attempt to disaggregate the data, even do a consumer survey to understand exactly why some people may or may not have qualified and whether or not there were any factors in that would be, let's say, problematic in terms of federal civil rights perspective?
Well, we do extensive consumer surveys of disaster survivors following disasters on a range of topics. But our gathering of demographic data has not been part and parcel of the individual assistance program. And we are taking steps now to make that part of what we do as a matter of course.
Okay, Well, thank you. Madam Chair, one additional question under your 2-question rule. For those of you who are watching, FEMA is more than just individual response. It's also community response as well through something called the Public Assistance Program, something that I'm very familiar with when I was working on behalf of the city and county of San Francisco when I was an aide to a member of Congress. The question I have is actually for, I think, Mr. Robinson, who is the regional administrator. And Mr. Robinson, thank you for the work that you do. I worked very closely with our Region 9 administrator throughout that entire period of time and found him to be a dedicated public servant as you are, and working under difficult conditions at best. One of the things I wanted to ask of you as someone who is more on the ground, as it were, is to what extent are you allowed, or are you permitted, or do you have authority to interact with local entities to whom you give grants, whether it's the CDBG-DR or what have you? And I'm specifically thinking about the articles that have come out about the initial plans by the Government Land Office of Texas with regard to the distribution of funds for home buybacks and hazard mitigation, where the amount of money, for example, in Taylor's Landing worked out to something like a community, by the way, that has absolutely no to very little Black residents, worked out to around $69,000 per capita per individual. In Port Arthur, which is a very large Black population, that the distribution of these public assistance funds worked out to about $84 per capita. Have you heard about that? And did you have anything to do? Did you have any reaction to that? And more importantly, does FEMA have any jurisdiction with which to ask the question of a grantee, why are you doing it that way? And what criteria are you using? And is it impermissible under federal civil rights laws?
Commissioner, thanks for the question. And so FEMA does not have authority over the CDBG-DR program. That is a Housing and Urban Development Grant Program that is administered by that agency. We have a Stafford Act Hazard Mitigation Grant Program, and we work very closely with the state, who is the grantee, but also have project managers who work with the local applicants as they put together their application packages and submit those into the state. Same thing under the FEMA Public Assistance Program. We have program delivery managers who work very closely with our state counterparts, but work very closely with the local governments as they look at rebuilding. And so in Harvey, what we looked at very closely was what needed to be rebuilt and how do we build that more resilient, implementing current codes and standards, current floodplain regulations, but working in the field with our program delivery managers, as well as our state counterparts, to help local governments recover.
Thank you. Can I have Mr. Chladny, Commissioner?
Thank you, Madam Chair. Ms. Johnson, I'm interested in FEMA and how they treat disabled people. And so my question here may sound complicated because I'm only allowed a couple. But FEMA has failed to develop assistance for disabled people that are power dependent, at least before Maria and Harvey. People who needed personal assistance, had service animals, bariatric equipment. Excuse me, I also have a phone that's in my room. And more importantly, people with mental health conditions like autism and support for people with cognitive and intellectual disabilities. It's my understanding many of these people were sent to long-term care facilities when in fact they could have been in shelters with non-disabled people. And I understand you have a training program called a Disability Integration Cadre. This is on your website. It calls for integration specialists and advisors who provide services at evacuation centers. One, I was wondering if you could provide us with a copy of the training program for providing these services that existed immediately prior to Harvey and Maria, and a copy that you currently have after Harvey and Maria. But I'd also like to know what's been done since these hurricanes to change this and comply more with Homestead?
Thank you, Mr. Chladni, Commissioner Chladni, for your question. I appreciate that. It'd be my pleasure to tell you a little bit more about FEMA's Office of Disability Integration and Coordination, or we refer to that as ODIC. ODIC is an office whose primary mission is to ensure that individuals with disabilities and the concerns and needs of individuals with disabilities and communities are integrated into a response to a disaster. And so the Office of Disability Integration and Coordination work hand in hand with our FEMA programs in response and in recovery to build in the appropriate responses and the appropriate considerations into those programs. ODIC also works with, in addition to FEMA programs and FEMA personnel, they also work with our SLTT recipients to ensure that they have adequately considered the needs of individuals with disabilities. As you noted, there have been concerns raised in several states about the sheltering of individuals with disabilities in long-term care facilities as opposed to in general population shelters with the rest of their community. We work, when those issues come up, we work directly with those states, with those localities to ensure that the communities of individuals with disabilities are getting exactly what they need. I'd be happy to take back your request for the training materials, and we can certainly provide that to the commission after this meeting.
I think really what I'm looking for is an answer as to what's been specifically done since then to make sure that disabled people are allowed to stay with their communities. I never get those answers, and I was wondering if you could provide that to me.
Yes, sir. And I certainly want to provide you with a clear answer. Unfortunately, the answer, like most things in disaster response, is actually quite complicated. FEMA is limited to working when a disaster strikes in a particular location. We are limited in working with the states within their own rules and their own regulations. And in different states, there are different regulations for sheltering, for example. Where that legislation is problematic from a federal perspective, that is where my office, the Office of Equal Rights, gets involved with the state, with our partners in ORR, to ensure that we're doing right by those communities. It varies from location to location, unfortunately, so it is not a simple answer. However, I'm happy to follow up with you on the particulars of our response in Harvey and Maria.
Thank you. And I have a question for Mr. Curry. Regarding insurance and funding, isn't it true that local governments underinsure their facilities, knowing that the federal government will come in and pay in the future? Shouldn't Congress require these local governments to insure up to fair market value?
That's a great point. We've never said in a study that that's definitively the case. However, it's pretty hard to argue that it's not. With hundreds of billions of dollars provided in public assistance funding, a lot of that going to repair public buildings, city hall, recreation centers, things like that. The question would be, why would a state or local government insure those facilities if they knew the federal government was going to pay for it? So I think that's a very valid point. In regard to Congress taking action on that, certainly I don't know that would be in the federal purview, because I don't know that they could require states or localities. I mean, they could look at the Stafford Act and make amendments to what would or would not be covered in terms of public facilities to maybe try to encourage additional insurance. But the other challenge in this area has been the same has been true in flood insurance, is that a lot of insurance, the insurance markets won't support that because it's just not actuarially sound. The risk is too high. So the federal government has to step in those cases and basically be the insurer.
Thank you. Thank you, Madam Chair.
Thank you. Commissioner Gilchrist, you've got your hand up.
Yes, thank you, Madam Chair. And let me thank all of the panelists for your testimony here today. My question is directed to Mr. Curry. Mr. Curry, in May of 2021, the president announced that FEMA will be receiving $1 billion for building what was classified as resilient communities, and a portion of that apparently is to be targeted to disadvantaged communities. Is that right?
That's my understanding.
And so I'm just, help me understand a little bit about what may be some of those activities that could potentially be targeted, and more specifically, your thoughts about how that should be rolled out.
Yes, sir. Great question. Well, the Building Resilient Infrastructure in Communities, or the BRIC program, is a new grant that is basically designed to be awarded competitively across the country to help state and local communities address those areas of highest risk. So the idea is you don't have to wait for a disaster to happen to get federal funding to rebuild in a more resilient way. We can be more proactive and hopefully avoid a lot of the damage and disruption in a community in the future. I am aware of the announcement that a portion of that funding will be directed, to vulnerable populations. I don't know that the specifics have been spelled out. Mr. Bebo may know that more, but I will say this, that I think it's going to be really interesting to see how, what criteria are used to make those determinations. I talked about this in my opening statement. One of the challenges that communities with fewer resources and more vulnerable populations, less educated, more low income, they don't necessarily have the same capacity and resources, to bring in the help to manage some of these programs. So, the question I would have is, how are these communities going to develop their plans for these funds? Because they have to justify how they're going to use this funding and provide technical assessments and risk-based decision-making and things like that. So I think that's something that needs to be addressed on the front end. How do we make sure that, a lower income county or community can compete with a highly resourced, county or community that has a tremendous amount of experience with these types of programs?
No, I appreciate your response in that regard. And certainly if there's information that would be coming out regarding now, Mr. Bebo, would you like to comment on that as well?
Sure, Commissioner, while the BRIC program is not in my area of responsibility, I am familiar with the fact that as part of the scoring criteria for BRIC funding proposals, 15% of that scoring considers the extent to which socially vulnerable populations were included in consideration for the application. While I'm not certain how the mitigation program intends to apply that, I can tell you that in our recent efforts around vaccination efforts, where we placed federally run community vaccination centers in selected communities across the country, we used CDC's Social Vulnerability Index to help guide us with the placement of those vaccination centers so that we could reach socially vulnerable populations as readily and accessibly as possible. So I'm happy to follow up with the program officials to get you some additional information for the record.
Please, that would be helpful. Thank you. Thank you, Madam.
I'm gonna call on myself. My question has to do with farmers of color. And to let you know that this is a family story. When my mother was 4 months old, she survived a hurricane in South Texas. Her mom and dad and her older sister spent the night in a chicken coop. That was the highest piece of property, the highest structure that they could take shelter in. And so given that low income of color, people in rural areas, have fewer resources and challenges in terms of communication accessibility. I'm going to ask Mr. Bebo, is there FEMA is doing directed at the rural areas and programs or data broken out by rurals?
Yes, Madam Chair, thank you for the question. And the answer is yes. In fact, when we deploy to disasters, we will organize ourselves in a way that gives FEMA field leaders responsibility for a certain geographic area, particularly in the significant incidents that we're talking about today and others that you will have heard of. What this does is it puts a division supervisor or a branch director, you may hear us refer to them as, in the position of understanding the geographic area that they are serving and understanding the population that they are serving and understanding how to reach the population that they are serving. This is something that we have gotten a lot better on in recent years, given greater ownership to our field leaders in how they reach populations that they're responsible for, whether it's different language approaches, or if it's a population that relies more on receiving information via radio than television, if it's a population that needs to, that is more likely to come in person to apply for disaster assistance rather than to pick up the phone or to go on the internet. It's a really working hard to try and meet people where they are. I'll give you a recent example in Lake Charles, Louisiana, which is an area that has been affected over the last year by multiple disasters, including 2 tropical cyclones and a recent spate of severe storms, and happens to have a lower vaccination rate than we are all striving for with respect to COVID-19. So in partnership with the state of Louisiana, FEMA Region 6, Tony Robinson's team opened a recovery service center to provide accessible information to disaster survivors cutting across all of these disasters, and provided the opportunity to be vaccinated at the same site. Not a thing that people are coming to the site specifically to do, but we're taking an opportunity in an under-vaccinated community to make it available. 14% of those who have shown up at the site have availed themselves of a vaccine, which is a positive story. But understanding the local community we're serving, trying to meet them where they are in how we communicate, what we communicate, and the services that we offer is something that we have gotten a lot better in recent years.
Thank you. I mean, it just anecdotally, we've lost a lot of nurses in areas that are rural, and they moved into the urban center. What is now a sizable problem for the rural is going to be even larger in the future. Commissioners? Okay, I'm going.
Yeah, I saw Commissioner Adams, and then I raised my hand, but
Thank you.
Adams,
Thank you. I'm glad you helped me
well.
with that. Commissioner Adams, and then I'll come back with Commissioner Yaki.
Madam Chair, thank you, Commissioner Yaki. My first question is for Mr. Bebo. Since you've been at FEMA in 2009, have you had the opportunity to hear or otherwise see firsthand or have any interaction or awareness of any racially discriminatory policies being discussed, or people even saying stupid things related to the distribution of aid in your experience there?
No, Commissioner, I have not.
Okay. My next question is for Mr. Sklar. Could you translate something for me? You used a term I was unfamiliar with, lost visibility of its commodity shipments. What does that mean?
Well, FEMA actually has some really nice processes and procedures to track commodities from point to point, for example, from the continental United States to Puerto Rico. And they involve things like GPS transponders that you can attach to a container. And there are actually seals they placed on containers so that when it reaches the destination, you can then download that information and know exactly what's in that giant container and if it reached target. But what we found in our review was that not all the transponders were functional, and that in the case of Hurricane Maria, that the seals were broken before the supplies even left the United States. In other words, the contractor just opened up the shipping packages and repacked everything, broke the seal, and then once it got to Puerto Rico, there was no visibility as to what items had made it to target.
Do you eventually turn it over to somebody in Puerto Rico?
A lot of these shipments were destined for municipalities in particular areas. So a lot of things get get pushed down to smaller and smaller shipments. But it was really important to know what actually made it over in the first place.
Has your office ever investigated or aware of any deliberate disparities, racial disparities in FEMA disaster aid allocation?
I'm not aware of any work in that area, but we are certainly aware of the media stories and really appreciated the discussion today. One of the first things we would ask for, likely if we were to do such a job or audit review, would be to ask for the data. So I think it just shows how critical it is to capture that data as we go along. One final point on data, we did do quite a bit of work on looking at the IT systems that were in place, and it is our sincere hope, and I think FEMA is responding, that they do allocate more money to automation and IT, including data capture. So when folks do arrive on site, that they can share information amongst themselves and with other individuals and other law enforcement agencies. So, but the data is absolutely imperative here.
Thank you. That's all I have.
Commissioner Yockey?
Thank you very much, Madam Chair. So I want to talk about, and I'm not too sure if this should go to Mr. Curry and Mr. Sklar or Mr. Debo, but one of the issues that is important toward being effective at both the response and the recovery is the ability to reach affected populations. And I'd like to understand what FEMA's policy is, or has it had a policy with regard to the issue of language and cultural competency of its responders, of its recovery individuals, of the people who go knocking door to door, verifying aid requests. That the whole chain of disaster response from the federal government. To what extent, for example, when you saw these hurricanes headed toward landfall in Texas, and when you saw this going toward Puerto Rico, to what extent, for example, did that mobilize or should have mobilized much more in the way of Spanish speakers in terms of understanding what cultural or other issues may be involved in trying to reach these populations in terms of making sure that they responded correctly. And we all know that there are many population, especially like if you're a dreamer, for example, or you have a parent or parent of a dreamer, you might be not willing to sort of answer the door if someone's knocking on it. How does FEMA, or how has FEMA, or has FEMA ever responded in that way or prepared in that way with regard to for Latinx populations that are going to be targeted by a natural disaster like a hurricane?
Commissioner, I think it's appropriate for me to start with that question if I can. I would first say that the quantity of personnel that we had who were fluent in Spanish as we approached a very significant incident, particularly in Puerto Rico, was a limitation for us. We did not have as many personnel that were fluent in Spanish as would have been helpful in delivering the assistance that we needed to deliver at speed. And thankfully, we're in a very different position today. We have now still more than 700 people that are FEMA employees in Puerto Rico, most of whom were hired locally in Puerto Rico after the storm, which is something that we can do quite quickly and do in many disasters that we face. And it helps us not only with language competency locally, but also with local knowledge. And with, again, going back to the point of meeting people where they are. We now find ourselves in a position where we have a solid core of Spanish speakers, which is I would say the most frequent language that is of greatest consequence in the disaster environment we're facing, but it's not the only And so we have to rely on a range of other tools, contractors, for instance, to resolve other shortfalls. But I'm sorry.
Just a quick question,
Yes, sir.
just to interrupt really quickly. That's great. How about the materials themselves? Applications, the website, things like that. Is there a language option in there as well?
Yes, and this is again another place where we've come a long way. We pay close attention to the languages that are in play in a particular area that we are working. I will tell you, for instance, this morning, right after the press release announcing the president's declaration of an emergency for Florida for the building collapse in Miami-Dade, went out in English. It went out in Spanish immediately thereafter. That is common practice now. The federally run community vaccination centers and those that we provided guidance to around the country that we provided funding for. We also provided guidance about language access and placing signage in multiple languages, as well as American Sign Language interpretation service availability. So we've really come a long way with this and take it very seriously.
And at the disaster assistance centers themselves, I know most of it's done online now. I mean, I remember the analog era where people would have to stand in line and actually submit their applications. But to the extent that there are still people on the ground, how about the contractors, for example, the people who go and verify the claims for individual and housing programs? Is there a way to assign and ensure that if the household is Spanish speaking, that they send a Spanish speaking contractor to them as well?
Commissioner, if I could, I would like to ask Ms. Johnson to say a word, because this is a part of what she has been leading as well across the agency, if that's appropriate.
Absolutely. Thank you, sir. Commissioner, I would say two things in response to that. If we have information ahead of time about the household that we are encountering, whether it's a language, a limited English proficient household, whether it's an individual who, harkening back to Commissioner Cladney's question about individuals with disabilities, if it's a household that has someone who is deaf and we will need a sign language interpreter, whatever the actual language needs, the communication needs are, if we have that information ahead of time, the answer to your question is yes, we can provide the assistance that's needed the first time they encounter FEMA personnel. In reality, however, we often do not have that information ahead of time, and that's where we can use technology to assist our contractors in the field. So we have at FEMA a robust language access plan that is on our website. We, Mr. Bebo mentioned our successes in the community vaccination centers and the language access that was provided in those community vaccination centers. One of the ways we did that is with a language line, where we provided information in over 180 languages based on an individual who walks in the door. We can get someone on the phone in their language very quickly. We can also do that, use technology to provide sign language interpreters on the ground immediately in front of an individual. So hopefully that addresses your question.
And Commissioner, if I may just add one additional item that I think will be of interest to the Commission. For the first time in FEMA's history, with the vaccination mission that the President launched on January 20th, we convened in FEMA's National Response Coordination Center a civil rights advisory group that was led by Ms. Johnson and helped promote and drive several of the initiatives that you've heard referenced here today with respect to promoting equity and access for socially vulnerable populations in that vaccination mission, including deploying civil rights advisors to FEMA's 10 regional administrators who were operationalizing a number of those programs. And so Ms. Johnson led that civil rights advisory group, and I just wanted to note that for the Commission's benefit.
Thank you, Mr. Debo.
Hey, Dave, if I can add, just as part of the region's pre-planning process for known threats and hazards, and as part of our damage assessment process, we collect that data as well, so that as we build our teams to send to the field, we take that into consideration as well.
I'm going to turn to David, but it is not a new problem that people need services and language accessibility in order to receive those services. A friend of mine filed a lawsuit on behalf of Spanish-speaking farmers in Texas, and the defense was they were being foreclosed upon, and all of the notices were in English. And their defense was, well, we didn't know where to find notices that had already been translated. And it turned out in discovery that the notices had been translated in Puerto Rico, and just the agencies that were foreclosing didn't know that. And so this was a problem more than 10 years ago, and that you're working on it now is wonderful. And I really thank you, Ms. Johnson, for saying that and for doing what you're doing. But it's an older problem, and it has roots in decision-making that impacted very heavily on people who are minority. So I'm going to call on David, on Commissioner Gladney. I'm going to give the last word to Commissioner Gilchrist, and then we're going to take a 10-minute break. So please be brief with us, okay? And the contractors are counting on me to be able to put this in a format that the public can view it. Commissioner Gladney.
Ms. Johnson, I've thought about the answer to one of my questions, and you said that the local governments seem to have different laws that seem to block you from providing disabled people the ability to be in the regular shelter with non-disabled people. Was that your answer? Did I understand that right?
To clarify, Commissioner Gladney, it's not that they block FEMA, it's that they can make it more of a challenge in that we have to intervene. I'm going to get this phrase wrong, and I want to give my colleagues a chance to correct me, but emergency management with FEMA is locally executed. And it's important to remember that at all times. FEMA is not necessarily on the ground with states, localities, tribes, and territories making decisions in the first moments that decisions are made. And when decisions are made that are counter to civil rights requirements, and I know all of you know this as civil rights practitioners, decisions get made, and we as civil rights attorneys have to come back and undo those at times. So there may be decisions that are made by states that are contrary to federal law. When federal funds are in place, we need to bring them into compliance, and that sometimes takes time. It doesn't always happen in the initial moments. And just again, Commissioner Gladney, to clarify, the trigger is when federal funds come into play. A state is free to respond to a disaster as it sees fit if it does not invite the federal government in. So it's a different question.
Do you, well, when you train the local emergency management people, don't you train them on Olmstead? Don't you tell them it's a requirement? Don't you tell them that they're supposed to, how they're supposed to react?
Absolutely.
So they still violate it and you still fund?
So what we fund and how we respond varies from disaster to disaster, and how a state, a locality, a tribe, or a territory responds without federal funds versus when there is a presidentially declared disaster and FEMA is involved, those are not always the same.
And I have questions for Mr. Schuyler and Mr. Begg. I was wondering, Mr. Schuyler, you said you're going to publish some post audits that you've done regarding Maria and Harvey. Is that correct? Your report?
So just to clarify, so we did complete 10 audits, and those are all posted on our website, but I can certainly make them available, point the commission to all of those. We have 6 additional products in process, and some begin to cross over into COVID as well, as we begin to look at the COVID response and FEMA's work on that.
Thank you. And for both of you, I was wondering if you were satisfied with the actions taken from FEMA and the responses to your reports and recommendations that were made as a result of the hurricanes and also their civil rights compliance.
I can try to answer first. I would say generally FEMA has been cooperative and certainly trying to meet the spirit of the recommendations that we have laid out. But I can't report that all of the recommendations have been implemented yet, and some are still under discussion. But for the most part, FEMA has expressed interest in cooperating and making necessary changes, and we really appreciate that.
Now, which ones do you think are the most important ones that are outstanding?
Well, one of the biggest problems we saw was the lack of advanced contracts in place. I think that could have prevented a lot of problems in some of these hurricane situations. In other words, you execute contracts beforehand and you may never use them, but they're there and ready to go. But when you don't have those, you're in the situation where you're just scrambling. And that was pretty apparent. So I think that's pretty important. And we also think it's really important to have much better tracking of all items from point to point. And there are a lot of issues that go with that tracking that can make things better. And finally, again, the IT suggestions are real. Just imagine hundreds of people pouring into a disaster response site and not having laptops, not having access to a network, and coming back from going out to a neighborhood and not being able to input what neighborhood they were just at because they can't get on the system. And that would go to your racial disparities. You need that data. So we really need a good IT backbone, and FEMA, it helps everybody.
Thank you. Mr. Bay?
Commissioners, we're going to start the next panel in 5 minutes. So I'm sorry, sorry, Commissioner Kursanau, I'm sorry, Commissioner Major. We need to stay on schedule. We are queued up to start. We're going to take a 5-minute break. And then please come back in 5 minutes because the next panel is ready to go. And so I thank everyone who has spoken, and I really appreciate the intense and specific questions that the commissioners posed. You are free to supplement the record later. We will keep the record open for 30 days. Also, if you've got more information, panelists, we look forward to hearing from you. See you all in 5 minutes.
Thank you all.
Thank you all very much.